High concentration masks. Non-rebreathing mask. This mask is usually used when high concentrations of oxygen are required. For example, with the critically ill or unstable patient. The patient breathes from the mask and the inspiratory valve opens so that oxygen is taken from the reservoir bag and the patient does not breathe room air. The patient breathes out through the expiratory valve. As the Eco High Concentration mask has a much improved fit, 2 safety valves are included. These allow the patient to breathe room air if the oxygen supply should fail. In reality, this type of mask delivers up to 80% oxygen with flows between 10 and 15 litres per minute. The fit of the mask and the patient's breathing pattern affect the amount of room air entrained and the oxygen concentration delivered. When using the non-rebreathing mask, first attach the oxygen tubing to the oxygen flow meter and set the flow rate to 15 litres per minute. Occlude the inspiratory valve, being careful not to damage the valve, and allow the reservoir bag to fill. Squeeze the reservoir bag to test the patency of the valve between the reservoir bag and the mask. If the reservoir will not empty, discard the mask, choose another, and test again. Place the mask on the patient's face, obtaining as tight a fit as possible. Adjust the oxygen flow rate so that the bag deflates by about 1/3 with each breath. Caution: flows must always be high enough to ensure that the reservoir bag does not empty completely at the end of inspiration. Minimum flow 10 litres per minute. Aspiration of vomitus is more likely when a mask is in place.